Welcome, and thank you for joining JDC for the second in our three-part series on JDC's coronavirus update briefings. Last week, we had over 200 people join, and I'm delighted to say that again today, we have over 200 people joining us for this webinar. Today, we will hear from Diego Orenique, Regional Director of JDC Europe and Africa Asia, who is joining us from Spain. Leila Sadicario, Director of Junction JDC Europe, joining us from Italy. And Sergio Huida, Director of JDC Latin America, joining us from Argentina. First, I would like to open this webinar with a thank you to all those who are fighting this invisible enemy on the front lines. Our doctors and healthcare workers, volunteers, police, and security services, the people stacking our shelves in grocery stores and pharmacies, and other such heroes and heroines who enable us to stay inside as much as possible. Before we get started, I want to share some technical information. You're on mute and we can't see you, so feel free, get comfortable, make a coffee, and listen. As you look around your screen, you should see a chat tool and a Q&A function. The chat function has been disabled for this call, so we kindly request that you enter your questions or comments into the Q&A function. Please feel free to share your questions at any point during the webinar, and we'll try to answer as many as possible during our Q&A session after the speakers. This is the greatest global health crisis of the last 100 years. Never have we lived through a period in which people in every country throughout the world are suffering the same fears, the same dangers, the same risks. If you are feeling anxious, worried, or stressed, you're in good company. But we are in this fight together. When it comes to real fundamentals like life and health, what unites us is greater than what divides us. And as a community, we at JDC have coalesced with your help and support to continue assisting those who rely upon us. As we approach Passover, there are two words we use for freedom. Chofesh, which represents our individual freedoms, which have generally remained in place throughout this crisis. We can still walk, write, eat without ration, and of course, watch Netflix and Amazon Prime. The second Hebrew word for freedom is cherut, which represents our collective freedoms, which have been stifled by this crisis, as we are forbidden to attend weddings, funerals, family Passover Sederim, and prohibited from gathering together to pray as a community. We pray that this Passover, soon this too shall pass, and we will swiftly be able to again enjoy our cherut, our collective and communal freedom. I would now like to introduce Diego Orenique, Regional Director for JDC Europe and Africa and Asia, to say some remarks from Spain. Diego.
Hello, everyone. You hear me? Great. So, regards from Barcelona, where I live, we've been locked down for 3 weeks already. And as David mentioned in the introduction, these are hard times for everyone in how we continue life, both professionally and on the personal level. And life goes on. I regrettably was part of a virtual Shiva last week as one of the parents of a colleague from Italy passed away, a former director of the Jewish community of Milan, as a result of the virus. So we are living a Jewish life, even virtually, with the joy and the always that this implies. I would say that from a JDC perspective, because we are able to have staff on the ground in multiple locations in Europe, our ability to help communities right away when the crisis starts is remarkable. We have people in Barcelona, colleagues of mine, in Milan, in Warsaw, in Budapest, in Bucharest, in Sofia, Bulgaria, in Riga, in Tallinn. So we are, there is a JDC person close to the committees right away, almost everywhere in Europe. Before telling you what we are actually doing, I believe it's important that I share with you that how we think about this challenge, which I imagine is not that different from how you think about it or what the experiences that you are already facing. First of all, clearly there is a pandemic and there is a need of dealing and protecting those who are ill and particularly the elderly. But second, there is an economic crisis that emerges as a result of this pandemic, mostly as a result of the lockdowns. So I invite you to think that all over Europe, despite of the numbers of people infected, because countries have a lockdown, there is an economic crisis affecting almost everyone in Europe. It's less related to the numbers, it's related to the lack of economic activity of the country as a result of the quarantines that were put in place. And as a number that I think is significantly, only in Spain, a month of a lockdown represents a cut of a 2% in the GDP. So if we imagine that this quarantine will continue for additionally 2 months or something like that, just imagine the economic impact that brings to the communities, to individuals, etc. So the second crisis, which is economic, is a crisis of the institutions. The Jewish infrastructure in Europe is no longer benefiting from years of remarkable development in terms of self-sufficiency. Participation fees are down, membership fees are down, and clearly local donations are down. So there is a struggle for survival. And the third crisis, which is the fact that the one that we are more concerned and the one that we are putting more of our efforts, is the crisis of the individuals. The elderly who are suffering from the isolation and need to be able to purchase medicine and food, having the resources, but also having the help in doing that to avoid going out to the streets. And the crisis of the new poor, as we call it, of those who were freelancer professionals who have not been able to make any income for the last months or months and a half, depending on the place. So we are seeing that communities come up with emerging needs with a population that historically was not in need of welfare support with the community. And while governments are thinking on how to help this population, so far the measures and the actions put in place were not sufficient. So what have we done? So far we have reached out to all the community leaders that we know to learn from their own needs, to understand how they are addressing this challenge, and to show that we are next to them. We were able to guide communities through the early stages, and being responsive to the emerging needs, we were leveraging our knowledge on resilience and the experience that we have in this field. And we prepare a guide to share with communities a set of suggestions on effective action in times of crises, which was translated to multiple languages and is being used by a wide range of communities to get organized their resilience capabilities to respond. And we are now beginning to turn our attention to the longer term and emerging needs, mostly focusing on the humanitarian aspect of the crisis. The demand of food, medicine, the demand of those who are now suddenly below the poverty line as a result of these lockdowns. Many of the Jewish communities have entered into a crisis management planning mode to ensure that these vulnerable people, the new vulnerable, are being taken care and looked after. Initial steps have included in identifying those who are isolated, particularly the elderly, and creating hotlines for support, both materials but also psychological, because we know the drastic effect of isolation in all ages, but particularly around the elderly. We were able to help communities secure so far their ability to provide home care for those who are in need, but we don't know for how long, and we don't know if moving forward, sending home care workers will still plausible and legal. There are amazing initiatives coming out from the communities. For instance, in Latvia, a Jewish community developed a phone application to reach out to volunteers, to show into the elderly houses, to purchase for them, to make sure that they need what they need, to make sure that they are healthy. So we've learned through this crisis that volunteers were always central. And now we realize that for the factors related to the pandemic, young volunteers are more needed than ever. And communities are ensuring that they are resilient and strong by bringing volunteers to their young volunteers to their workforce. Let me end up my briefing by saying a couple of things. We are doing our own homework, and the homework has to do internally in JDC in understanding that what is coming in front of us is probably the biggest humanitarian crisis that we experienced for sure in the last 30 years, and hopefully moving forward. And we need to respond, and we need to help people, and we need to ensure communities are in place when this is over. Our own homework consists of ensuring that we shift existing allocations for the new priorities. We are prioritizing new needs as a result of this emergency. We are giving priority to issues such as, and services such as social welfare activities, the provision of food, the provision of medicines, even in places which we were not allocating welfare resources in the past. This might soon include a response in Italy and in Spain, as long as the crisis evolves. We are also identifying potential savings as a result of this situation that were available in the organization and reshifting them to these priorities. We are building on the resilience capabilities and the resilience programs that we implemented all across Europe as a basis to ensure that communities are resilient and they can respond. And in addition to that, we know that this won't be enough, and we are preparing ourselves to rapidly shift into a more emergency mode to make sure that the priority in making sure that individuals who have no incomes across Europe can be supported, can be helped, and we are building on the resilient capacity of each Jewish community. We have a long-term partnership with most of these communities across Europe, and we are partnering with that in making sure that the most vulnerable get covered.
Thank you very much, Diego. As a reminder, if you have questions, please use the Q&A button on your screen and share them with us. I'd now like to introduce Lela Staricario, Director of Junction in JDC Europe, who is joining us today from Italy. Lela.
Hello, everyone. I hope you're hearing me. Hoping you're all safe wherever you are at this moment. I'm Lela, and I live in Milan, Italy. I assume you all have been hearing and following Italy in the news about the COVID-19 outbreak that started more than a month ago. And to echo Diego's words, this is not happening only here to me, it's happening to you and everywhere else across the globe. I said I'm in Italy, but I was not born here. I was actually born in the former Yugoslavia and grew up under a communist regime. So I could say I'm no stranger living under fear and uncertain times. With the fall of communism, the only certain thing that happened in my life was the commitment I made to have a Jewish life. thanks to one special place that some of you might have heard called Szarvas, a JDC summer camp in Hungary. Szarvas for me, as many of my peers, was a place of Jewish discovery, growth, but as well a shelter when we most needed it. When this all started, people were calling me and asking me how I felt. I could not help think back to me early years in the former Yugoslavia and share that in many ways, it feels like a war. That was the last raw trauma I experienced back in the 90s. The panic, the anxiety around food supplies, the acceptance to be locked down in a small apartment with 2 kids and a husband that also needs to maintain a job, the fear about the virus spread, waiting every day at 6 p.m., which was 1 hour ago, to hear and see the numbers that grew insanely day by day, to receive phone calls about people who got infected and people who have died. Unfortunately, we also had a loss in our family. We even begin to discuss and hope not if we will get the virus, but when, hoping and praying it won't hit us hard. It came as a shock to me that this was my state of mind. But that's what reality had become, not just for me, but I imagine also for some of you. I made a decision and chose not to fall in the victim trap, but to get active and seek ways how I could be of help. Luckily for me, I'm privileged to work for JDC, where I direct a program called Junction. Junction is a partnership with JDC and the Schusterman Foundation, whose mission is to help Jewish young adults in Europe to become engaged, active, and lead a Jewish life of the community. We assist and support hundreds of active Jews to create experience and programs that together engages over 7,000 young adults across the European continent. We spend most of our time ensuring young adults play a key role in securing a relevant and ever-evolving Jewish present and future for European and global Jewry. When the crisis started to hit more countries, me and my team shifted online. Yes, we wanted to keep Jewish life going, but more than that, we understood young adults are also vulnerable at this time, and we wanted to have a way to get in touch with them, to keep that connection, to help them be together with others and make sure that they were okay. The programming we offer are various, but the main focus is on the young adults and their responses to the crisis. We in JDC Europe specifically have always claimed if a robust and dynamic programming exists, if you involve young people in decisions, if you trust and invest in them, then you will be a resilient community for the future. You will have access to the most wonderfully creative and committed social capital. As we spoke more and more to people, we learned that we knew which is that in that time when it matters most. The young adults answered the call and said, "Ineni, we are here for you as you have been for us." Young adults, our people, are part of the solution. I heard from a girl named Blanca in Sarajevo, Bosnia, how the elderly cry as they are delivered packages saying, "We did this for you during the war, and now you're doing this for us." I heard from a grantee in Vienna how the more traditional community structures have shifted so that now young adults, lay leadership, professionals have all become simply partners in caring for the most vulnerable among them. And I can share that across Finland, Denmark, and Sweden, there's an effort of a Nordic team together with all the connections they have from programming we have helped support it over the years. All of this left us in admiration and awe. And as we share the stories with others in the region, we do this with intention because these initiatives are needed now. But most importantly, we do it for tomorrow, as we will need strong leadership for the aftermath that comes. Without a doubt, we are all sure that the cost of ending this crisis is enormous. Looking at Italy, we already see signs of that anxiety rising among people about what follows next. First is this economical shock. Most of the communities in Italy depend on membership fees and tourism as the main income for the institutions to run. I'm sure that many of you have planned to come to Italy and that trip got canceled. I hope when this is over, you'll come back. The percentage of people with no income is growing rapidly, and overnight they are becoming the new form of poor. a poor that Italy has never heard of. We hear everyday stories of people, friends of mine, who get fired from their jobs. The ones who have children in the Jewish schools are asking for the money back as schools are closed. I just spoke to a social welfare worker in the community, and she said to me, mental health issues are growing. People with anxiety or obsessive compulsive disorder are really in struggle. Elderly people who are already excluded from much of a public life are deepening their loneliness and their depression. Cases of suicides have shown, and incidents of domestic violence and child abuse are in increase. And probably as I'm speaking, this list of issues is growing. This all gets me nervous and worried, but I'm confident with the work that JDC does now in the region and globally will enable for us to somehow respond and pick up the pieces of what is left from the world after. I hope that the global communal spirit of mutual responsibility you all have been investing in will continue. Thank you for giving me the time and for listening. I wish you all good health and safety. Thank you.
Thank you so much, Lela. And we know that yourself, Italy and to Diego and Spain, two countries that have been hit really hard, and we're sending warm wishes to both of you. Keep sending in those questions, please, via the Q&A function. I'd now like to introduce Sergio Huida, who's our director for JDC in Latin America. Sergio.
Hello, good afternoon from Buenos Aires. I live in a city which is the home for approximately 1/3 of the Jewish population in Latin America, and where JDC headquarters its programs for the region. I'm speaking from home. This has been the case for the last couple of weeks since the country started in lockdown. A lockdown that is likely to, so far is due to remain until April 13, but it's very, very likely that it will be extended at least until the end of April in order to help flattening the curve. I assume that most of you, of us, have become familiar with this expression in terms of the spread of the coronavirus. This lockdown, and I will go into that in a few minutes in more depth, has impacted seriously in an economy that was already in a very bad situation in the case of Argentina. To give some broader context about Latin America, we're talking of a region with high levels of inequality. We see headlines and we read news about how COVID-19 has already impacted or is projected a scope of the impact in Europe or the US, but we do not know yet what is going to happen in our region. What we can anticipate is that the economic recovery in a broad sense will very likely demand longer terms than in other places in the world. Remember that we're talking of a region where tens of millions of people have very limited or no access at all to running water or sewage systems. What's going on in Latin America and in places like Cuba, Venezuela, and Argentina, which are the three countries that I will focus on now, is that the COVID-19 is not now reverting a good cycle or a cycle of growth or expansion of the economy, just the opposite. It's only aggravating an already very bad pre-existing situation. And that is why, same as what Diego said regarding Europe, we are shifting from our three programmatic areas in our strategy, which are working with vulnerable communities or vulnerable Jewish population, capacity building, and leadership training. We're shifting towards addressing vulnerability, addressing most basic needs, the humanitarian work, which is the JDC's DNA. Before I jump into referring to Venezuela, Cuba, and Argentina, I would like to stress that we need to be discreet about what I'm going to tell you regarding Venezuela in particular, because this might undermine our efforts and our work in that country, and also put that community, members of the community, at a high risk. So this is not for Twitter or Facebook or Instagram. I ask I know about your sense of responsibility, so I simply want to say it as I always do. What we are doing in those three countries, we can only do because JDC has always been there. JDC has been working with these communities from long before coronavirus. We're not parachuters who are arriving now. We have worked and have built strong relationships and partnerships. We do not have staff deployed across the region in Latin America. Our staff is basically staying in Buenos Aires, but we work with partners locally. And that is the case, for instance, in a place like Venezuela. I won't enter into the general background of Venezuela, which I assume you may know. For the last 3 years, JDC has been the community's lifeline and the provider of food, medicines for the most vulnerable Jews in that country. The country is in lockdown. There are further shortages of basic goods. This means that the prices are going up. And Tarang, if you can show the first slide, what you can see there is the food program, volunteers preparing the Passover supplies to be distributed among the clients. If you, Tarang, please, next slide. I assume that you've seen many of these Zoom screen captures during these days. What I want to stress about this particular call is that we brought together representatives of all the key leaders of the community and all the welfare programs and the JCC. There you have people from the Sephardic and the Ashkenazi community, the Jewish Day School, the JCC, the Beit Avot, security, coordinating efforts. Those people wouldn't get together to coordinate if not for JDC. Next slide, please. In Cuba, where the country is going through a situation very similar to what was the so-called special period just after the collapse of the Soviet Union. And it was then when JDC was able to re-engage with that community and help them build this vibrant life they have today. We helped them coordinate, since the synagogues in Havana are closed now. We helped them coordinate to deliver the Shabbat meals and the medicines to the members of the community across the city. And since I have very limited time, I want to go to Argentina. I want to mention that, as I said before, COVID-19 is aggravating a very bad economic situation. The GDP of the country was negative in 2018. In 2019, it was projected to be negative minus 1.2 for 2020, and it will be much worse now with the COVID-19 effect. High inflation, higher vulnerability. Argentina knew of the new poor that Diego mentioned that is going on now in Europe. This was the case for Argentina in 2002, and yesterday the main expert on poverty in Argentina said that the COVID effect in Argentina will very likely add a new layer of new poor. This is middle class, lower middle class people who are making no money these days and are in the risk of falling into poverty. What we are doing, we are working with the local organizations that address direct assistance to Jewish poor in Buenos Aires and the metropolitan area, while we keep our direct support to 15 communities in provinces of Argentina. These three organizations, AMIA, Buenos Aires Kehilat, Tzedakah Foundation, and Chabad, are working together with us to address these emerging needs, and very likely to keep this going on once the COVID-19 effect, the initial effect is over, and we need to keep sustaining the local platforms to provide care for the neediest ones in our community. There's much more to say, but I know we're short on time. So I leave it to Q&A.
Thank you very much, Sergio. So thank you very much to everybody who has sent in questions. I'm going to try and get through as many of them as possible, and by combining a few as well. So we're going to start with a question for Diego and Sergio. So given all the restrictions that are out there at the moment, and Diego, we'll start with you, how do you organize staff and volunteers as head of a big region in Europe and Africa and Asia? And Sergio, you across Latin America, how do you organize all the staff and the volunteers to keep delivering the humanitarian assistance that you spoke about to our clients? Diego.
So first of all, it's good to clarify that generally speaking, we work with the communities. So the communities, the partnership with the communities, it's built on training volunteers. This is what we do. We train volunteers. We train them on resilience capabilities. The communities are the ones recruiting. They have the infrastructure to do that. But I would say that communities are able to respond today, mostly because we were able to work in partnership with them in raising the case for volunteers, in training them, in helping them recruit, in creating applications so they are connected. We started under the leadership of Amy Bressman when she used to be the JDC chair for Europe. We did it mostly because our concern was the rise of anti-Semitism in Europe, and we helped communities raise their level and numbers of volunteers. Now these volunteers are critical in this pandemic, but basically the one that actualized the collection and the recruitment are the local communities. We just trained them and we elevated their skills.
Sergio.
We are who actually distribute the goods. We, as I said, we partner with the local communities, and in the case, for instance, of Cuba, we help them organize themselves because we are not there, we're not on the ground in Havana today, so we help them coordinate and organize the distribution among the members of that community. In Venezuela, that's the same case. I mean, there is the food program with whom we partner, there is the medicines program with whom we partner, and usually people go there today, they are organizing the distribution with volunteers to the home of each of the clients, with an additional challenge which seems quite ironic for a country like Venezuela, which is that there is a shortage of fuel. Let me remind everyone here that Venezuela has the largest oil reserves in the world. And not long ago, fuel was almost free in the country. I mean, you could drive to to gas station and get fuel really for free. In Argentina, we are considering funding also, giving some additional funding to our partners to help them distribute the goods among the people, or send them for them to wire directly the money to the people to be able to purchase the goods themselves.
Thank you, Sergio. Okay, next question is for Lela from a number of people who want to hear more, including from my friend Myron in LA. Would like to hear about what is the reaction of the Italian Jewish community? What are we learning about them, about your community in Italy, from their reaction to this crisis?
Okay, so first of all, to give you a better understanding, Italy is very big and it has 60 million people. The Jewish population is 35,000 in total. Most of the Jews live in Rome. However, when the crisis hit it Milan and the areas around Milan. So what I would say is a learning point for the community, what was the reaction? Timing was everything. They jumped into creating those hotline being open, reaching out to community members, trying to understand what is the need, going beyond just supplying food for the elderly and for those who were already clients for the social welfare department, but they were trying to map the needs of every member of the community. And they have done an incredible job in the beginning. We were also contacted by the community to understand what is our situation. However, as time is passing, this coordination and this rapidness is starting to slow down. People are getting tired. There are not so many people involved in terms of running this crisis. I'm trying now to be close to the community to try to see what are the solutions regarding that. Now, the Federation of the Italian Communities, UCE, as an organization, is trying to be centralizing the data and centralizing the crisis in order to be able to respond and to help the different communities, Milan, Rome, Turin, Florence. Everyone has different needs. Everyone has a different approach. However, they're trying to be kind of sheltering everyone and playing an umbrella for everyone. Where I see the crisis is hitting the most, where I think the community would have done better job was once the decrees were starting to be more and more restrictive, and less possibility to go out. Volunteers were not able to perform work. The isolation, the decree around isolation meant no helping others in terms of groceries, in supplying food, and etc. And it took a little bit of time, I would say 2 weeks, to get that permission. Now they have it, and now more than 45 young volunteers are being outreached, and they've started to do a delivery around not just only the vulnerable, but everyone who needed help in terms of bringing them packages for Pesach, and plus supplying foods from grocery stores. So where else we are seeing that the crisis is really hitting hard, definitely are the schools. I've heard that all the teachers will be on unpaid leave, but now they're putting them to be on a layoff, which is called Cassa Integrazione, which is provided by the state, which secures 80% of your salary for a certain amount of time. This is not really a solution, but it's a temporary solution. I think there will be a tempesta. It will come as a tornado after everything finishes. I mentioned about the new poor. These are mainly young people who are working in hospitality industry, merchandising industry, who are closed for already a month and so. We will be probably closed for this month as well. Everybody's hoping end of April that the restrictions will be loosened. However, nobody guarantees that. That means people are not getting salaries, people are not getting money, and their anxiety and their disappointment is starting to rise, and they're turning to the communities asking for help. The community, what I've learned, either it's Milan, Rome, Italy in general, they do not have the capacity to respond to the need which comes afterwards.
Thank you. Next question is for Diego. Diego, are you hearing about any rise in anti-Semitism in the communities that you oversee?
Indeed, yes, but in a different format. What we've seen so far is a rise of anti-Semitism online, precisely because the communities are empty. So there is a fake illusion that for a while things are more, I would say, are safer, because the security agencies, the community security agencies all over Europe are turning into a resilience centers. I can speak about SPCG, the security agency in Paris, which they do amazing job protecting the Jewish communities. But today, in the context of the crisis, they are the main agency addressing the needs of the individuals who are in quarantine. So we see a rise of anti-Semitism online, conspiracy theories about giving example in Spain, one of the owners of the main supermarket chain is a group from Jewish businessmen from Russia. So you see online that people are posting things like, well, this is a virus introduced by the Jewish people so they can increase their profit, these type of things, or blaming Israel and so on. So there is a lot of traffic on anti-Semitism online. Clearly, in terms of the physical threat, it's not there because communities are in many ways closed down. The only areas in which they are still open predominantly is in the welfare departments. But I think that that's a main challenge, which is how this increase of anti-Semitism, which today doesn't bring any concern on the safetyness or the security of the people, might translate later on into the actual space of anti-Semitism and risk for the communities. And that, if I might say something, is an invitation which this crisis has a paradoxical effect. On the one hand, we are saying we need to rapidly shift to be mostly a humanitarian agency. So this crisis goes quickly or as quickly as we can, the crisis of the individuals. So later on, we can contain and support the sustainability of the Jewish institutions, which are deeply at risk as a result of this. So the faster we help communities deal with this crisis of supporting their members, the faster we'll be able to deal with the growth or the revival of these institutions. And this applies to the security infrastructures that will be needed, I believe, to upgrade as a result of the growing anti-Semitism online.
Thank you. I'd like to ask the same question to Sergio about increases in anti-Semitism in Latin America, and a question from Daniel, who also wants to know, are there any restrictions on JDC activities in the countries as well?
Okay, let me start by the second question. There are no restrictions. The restrictions are mostly the fact that we cannot go to some places. We cannot go to Cuba because we cannot go anywhere. But we make sure that the work continues on, no matter the fact that we have to stay in Buenos Aires. the JDC person who works more closely with the Jewish community in Cuba, she is based in Costa Rica. And even if she is much closer than we are in Buenos Aires, she cannot fly there, she cannot go there, but she is in contact with them. I wouldn't say daily. I mean, many times during every day. Regarding anti-Semitism, I have to say that there has not been much of anti-Semitic activity related to COVID-19 in the region. Yes, there are some marginal groups that go online and repeat conspiracy theories. There are just a few things that are probably somehow caught my attention when that there were people targeting the owner of a pharmaceutical company who is Jewish and who was attacked by those saying that he's the one who's gonna monopolize the vaccine or the cure for COVID-19. And then there was something that was not specifically anti-Semitic, but I would have preferred to remain more discreet. There's a group of very prominent Argentinian businessmen who decided to get together to raise funds for the Argentinian Red Cross. Among those businessmen, many Jews. And a Jewish outlet, a Jewish radio in Argentina, published a headline saying that Jewish businessmen are leading the effort for combating COVID-19 in Argentina, which on the one hand, you can say, well, it's nice, it's a good way to present Jewish businessmen. On the other hand, there are people who can say, well, we don't need to stress that these are Jewish businessmen because, in fact, there are also non-Jews. I mean, that's the situation here. I have to add that even in the case of Venezuela, where we are somehow more concerned in terms of anti-Semitism, the government lifted the restrictions for Passover supplies that arrived in the port, which is outside the city, and the roads are closed. They allow the kosher for Passover supplies to go into Caracas for distribution among the community members. That's by no way saying that the Venezuelan government is friends with the Jewish people or with the state of Israel. Let me be very clear on that.
Thank you, Sergio. Next question for Lela. So when we were preparing for this webinar, Lela, we were on Zoom together. And one of the things I noticed was sort of you were a little anxious and you were counting down the hours until the counts came out in Italy of the number of deaths. And it comes out at a certain time every day. It made an impression on myself. How do you personally stay motivated as a leader of the Jewish community there for so many others in such trying circumstances?
It's a very hard question, especially to ask me today. I just had something in our family that happened. My little nephew got hospitalized as he has the virus and he's in a very bad condition. So maybe today I'm not able to ask, but answer this question. But I think is the routine and asking every day myself, will I be a victim of this, or I choose to embrace the situation in which I am and find ways to act and react. And I do it as a JDC professional, but I also do it as a volunteer in the community. I am in touch with the community as a JDC professional, but I'm also in touch with it as a member of that community. And I'm trying to seek ways how I can be of help, how I can be close, and it keeps me moving. It keeps me really going. And I don't focus so much on the number. I do focus on the curve. I'd like to understand where we are at the curve, as the uncertainty is, did we reach the peak? Are we reaching the peak? Did we pass that peak? And there are so many speculations around that. But I don't focus anymore so much of the numbers, even though I'm there to hear the numbers. I'm hearing, okay, what I can do in order to help the people that got infected and who are in that crisis. As now I'm thinking how I can be a use for my sister-in-law and what she's confronting at this moment.
Thank you. I'd like to ask a similar question to Diego. Diego, from a personal perspective, what is your voice of optimism and hope for the future for European communities and for yourself as we emerge from this crisis?
It's also hard. It's hard because there is something unique about this crisis, which is it equalizes everybody. All of us in this call, I assume that most of us are in quarantine somewhere else. So we are part of the solution, but we are also suffering from it. So the optimism comes from two sides. From the side that the so-called Jewish responsibility is more alive than ever. And I feel it, and our partners and our clients feel it. When an elderly gets a food package delivered by a volunteer, the level of recognition and gratitude is amazing to levels we've never seen. So simple facts of lives that we take for granted now are a value. The sense of community, even virtually, is higher than ever. And I do believe that communities and community leaders understand that we are making the biggest efforts. Sometimes are not enough, but the level of understanding each other's role, understanding how Jewish solidarity is spreading all across, both in time, online, but also in funding. So I do believe that this is the solutions won't come up right away, and this is a difficult time. But there is also a space for hope as we see how we collectively behave in this crisis as Jewish people.
Thank you, Diego. Sergio, in 1 minute, please. Same question for you. A final note of your vision of optimism and hope as we emerge from this crisis.
Well, very similar to what Diego said about Europe. Communities are working together with us. Communities trust JDC. Communities know that JDC will continue with them. And they know that many of the good things that they can do, even in this context, is because JDC helped them strengthen their capacities, help them build vibrant Jewish institutions, and that we are there even in the most difficult times, and that we will overcome this situation together. There will be there will be new context, new settings for the communities, and we will continue being partners with those communities for the future.
Thank you. And Lela, final word from you, please.
Starting from a personal note, that I got to know all my neighbors just with the outbreak as it started. Every day at 5 o'clock we meet and we have a chat. But going to the community, definitely the trust came back to people, to members, that this is an institution that is valid, this institution that has my back, and trust towards JDC that never ceased. communities right away remembered. It's in their DNA who was there to help them when they needed. Was there in Italy when after the war to give funds for the community to be rebuilt. Is there a community in Eastern Europe which struggled after the fall of the communism? From all across the continent, we see that trust, and what we see is this communal spirit and this unifying way of understanding that we are here for one another, and it's happening to all of us. And nobody's disaster is greater than the others. So there is something really human that is happening today, and we need to embrace it. I hope it keeps us going. As Diego said, the online programming is beyond amazing. There are thousands and thousands of people viewing the content we have on our European online programming. Many people coming from the States, from South Africa, from Australia. We do attend programs which are on different continents, and it just gives you the example of Klal Israel, that you want to know what is happening everywhere around the globe, because you care and you feel for everyone else. And yes, I am optimist, actually. With all the hardship that is going on, I know this will give also something good.
I'd like to thank everyone for joining today. I'd like to thank all of our speakers, and I'd like to thank my wife for keeping the kids quiet in the background. If you'd like to learn more about the work that JDC is doing, we invite you to the website, where we will keep the information as updated as we possibly can. As you heard today, while responding to this particular health crisis is new for JDC, responding to emergencies is not. We are in unprecedented times, and this crisis is reaching into every aspect of our lives. And that is why we are so appreciative that you joined us on the call today, because you care. The third webinar in our series will be this coming Monday, April the 6th, and will include voices from around the world sharing how our communities are celebrating Passover during this difficult time of isolation. We're working toward a common goal. People are depending on us, relying on us, and we're thankful for the work that our supporters allow us to do. Most importantly, please stay safe and healthy during these extraordinary times. JDC will continue to be there for those who need us most without fail. Thank you.